Hello, my name is Leon Covington and my fellow group members are Vanessa Edwards and Jennifer Dyer. We're three MSW students working on a project that describes and demonstrates an evidence-based therapy treatment. The evidence-based treatment that we chose is ART, which is Aggression Replacement Training. And ART is a form of CBT, Cognitive Behavioral Therapy. ART is a highly structural cognitive behavioral intervention program designed to target youths ages 12 to 17 years old with improving their anger management skills, reduce their aggressive behaviors, and improve their social skills and moral reasoning. ART was developed in the late 80s by Barry Glick and Arnold Goldstein. Since then, Glick and Goldstein have made several changes to enhance the effectiveness of the program. ART is a 10-week program that runs 1-hour sessions 3 times a week to total 30 hours of intervention training per week. The program is divided into 3 components: social skills training, anger control training, and training in moral reasoning. ART has been implemented in schools and juvenile delinquency programs across the United States as well as throughout the world. The program targets chronically aggressive children and adolescents. In recent years, ART has been modified for adult populations as well.
So the theories that are connected to the techniques of ART, like Leon had talked about, is a combination of cognitive therapy and behavioral therapy. The 3 main components I will go over a little bit. The first one being social skills training, that's the behavioral component. And with that, what they're trying to teach is pro-social behaviors to adolescents to hopefully replace their out of control and destructive behaviors, replace that with the positive behaviors that they're learning in the group. It teaches kids what to do and what not to do in stressful situations, and the curriculum that they put into practice, they're learning by modeling, role modeling, and performance feedback. Some examples of the 50 different desired skills that are in the curriculum are things such as understanding how people feel, so trying to teach empathy. It's talking about how appropriate ways to start a conversation, appropriate ways to learn how to apologize and ask for help. So those are a few of the examples. The social skills training, these methods are taken using components of the social learning theory and Bandura's work, which was early 1970s. As far as the second component is the anger control training, which this is the part that we'll be demonstrating in the second part of the video. This is the affective component, and what they're trying to do here is they're aiming to actually decrease the anger in these adolescents and be able to educate them on ways to have self-control and increase their self-control in anger situations. It teaches the kids, again, what to do and what not to do in problematic situations. Each session they teach a different type of anger control training. So for instance, the first one being how to identify their triggers. Second session they'll teach cues, anger reducers, things such as that, which, like I said, we'll be going over that in the second part of the video. The anger control training gets its basis from the early anger control work of Navako and Meichenbaum, which was again early 1970s. At that time, their goals were to teach younger children how to do self-control and have anger management and stress management skills. The third part is the education in moral reasoning, which is the cognitive component. What the trainers do is they give opportunities to the adolescents to increase their awareness of the perspective of others. So again, teaching empathy. They give them several different problem scenarios, so different moral dilemmas where the kids have to choose a side and be able to speak to why they chose that side and what to do in those situations. The moral reasoning is founded in the Kohlberg's model of moral development with the goal of improving the kids' levels of fairness, justice, and concern with the needs and rights of others.
In the late 1980s, when Goldstein and Glick started using aggressive replacement therapy, it was in juvenile institutions primarily. But because of its success, it's been moved now to school settings, treatment facilities, and mental health inpatient and outpatient. clients that normally respond very well to art are aggressive males and females between the ages of 12 and 17, who often are repeat offenders. They can be both voluntarily engaged in the program with high success or on probation. Mainly the groups consist of kids between the ages, or groups of kids in groups of 8 to 12. Usually youth that are part of the aggressive replacement treatment program are clinically aggressive and chronically aggressive. Many of them have antisocial personalities and behaviors, and have been diagnosed with conduct disorder. Many of the behaviors manifest in many different ways that can be problematic for them and cause them to be aggressive towards society. The youth that we're going to work with today is Armani, and he is a 12-year-old boy who's residing in a juvenile detention center with charges of aggravated assault against 2 youths in his classroom and an adult teacher. This is his 10th offense, and he will be participating from that treatment facility. As part of his long-term probation and sentencing into an institution, he will participate in aggressive replacement therapy training. With Armani, we will have 5 other male youths in our group, and it will be led by 2 trained therapists. During this group, the youth will each have a household log that they'll present during group to help them with their behaviors.
Our group chose to use ART because it's the model that has been chosen by the United States Office of Juvenile Justice and Delinquency Prevention. And outside of the United States, it's also been chosen by the United Kingdom Home Office as well. It is classed as a promising approach by the United States Department of Education. And what we're going to look at now is some different research that has been done supporting the effectiveness of ART. And we're going to look at a study both locally in Washington State as well as outside of Washington State. The first study was conducted by the Washington State Institute of Public Policy. And in that research study, they compared control groups with youths who participated in ART program, and those youths significantly acquired and transferred 4 of the 10 skill streaming skills: expressing a complaint, preparing for a stressful conversation, responding to anger, and dealing with group pressure. Similarly, significant ART versus control group comparisons emerged for the number of intensity of in-facility acting out and for staff-related impulsiveness. During the 1-year follow-up, 54 youths were released from the facility. Of those released, 17 had received ART and 37 had not. In 4 of the 6 areas rated, namely home and family, peer, legal, and overall, ART-trained youths also rated significantly superior in community functioning. The next study we looked at was conducted in California, and the California Institute of Mental Health sponsored ART for 25 counties and 30 private providers who have participated in expert clinical training and have been successful implementing ART in a variety of settings. These interventions involved 3,482 youth. They were served through county and private agencies in a variety of settings, ranging from outpatient diversion prevention to residential facilities. Social skills were assessed using the skill streaming structured learning checklist in treatment facilities, camps, and ranches using this curriculum. Ratings by youth, parents, and teachers show significant gains in targeted skills, 11% to 40% increase, to be exact. Anger control training groups were evaluated with the aggression questionnaire. And that shows significant decreases, 7% to 11% reduction in aggression. The moral reasoning outcomes utilizing the How I Think questionnaire show gains ranging from 7% to 12%. So in summary, multiple studies indicate that ART can be an effective intervention for incarcerated juvenile delinquents. It enhanced prosocial skill competency and overt prosocial behavior, reduced ratings of impulsiveness, and decreased acting out behaviors while enhancing levels of moral reasoning.
So the particular skill that we will be demonstrating in part 2 of the video will be educating the clients about external and internal triggers. We will be discussing the differences in triggers and how each client should be able to identify their particular triggers. Another essential part of learning these skills will be utilizing the hassle logs to ensure that the clients are truly understanding the skill and that they're able to apply their new knowledge into their everyday lives.
Welcome to part 2 of our presentation. This is the part of our role play. The setting is that we are in a long-term juvenile detention center with Armani, who, just as a reminder, is a 12-year-old boy who has a history of aggravated assault, and more recently he assaulted 2 other students and a teacher in the classroom. So he, with 4 other of his peers, are here at the Juvenile Detention Center long-term. All of them share aggressive histories, including antisocial behaviors and conduct disorder.
Okay, and just as a reminder, this will actually be we'll be showing the first session that we will have started with ART with the kids. And so just for sake of time, we will have already kind of did like a welcome, welcome to group, why do you think you're here? We will have already had snack and already did kind of like an icebreaker to have everybody kind of get to know each other a little bit. We will have already went over the rules and expectations of the group, which in this kind of a setting is very important to do to make sure you keep control of the the environment. Like we go over the importance of respect, having a positive attitude, participating, and what we call the Vegas rule, which is the confidentiality piece of what's said in this group setting has to stay here for the confidentiality of the clients. And you'll also be seeing that they'll be reading off of sheets. Again, we will have already had them fill out their different anger sheets, kind of talking about 7 to 10 things of what makes them angry and 7 to 10 things of what they do when they're angry, because the skill that we're going to be focusing on teaching them today is being able to identify external triggers and internal triggers. So we will go ahead and start the group.
Alright guys, the first activity we're going to do today is those sheets that we asked you guys to write down 5 to 7 things that made you mad and what you did when you were mad. I just want to go over those a little bit. So we'll have you read 2 from each list. Who would like to go first?
I'll go first.
Leon? Alright.
Whoa. Man, you're a good thrower.
Well, hold on one second, Leon. Hey, we need to make sure that we're listening and being respectful to the person that's speaking, okay? All right, thank you.
Okay, 2 things that make me angry. The one thing that makes me angry is when people lie on me. I hate when people lie on me. And another thing that makes me angry is when I get bad grades. I hate getting bad grades.
It's frustrating.
Yes.
What do you do when you're mad, Leon?
When I'm mad, well, one thing I do is I throw chairs and tables sometimes when I'm mad. Another thing I do is I fight. People lie on me, I usually fight them.
Thanks for sharing. Who'd like to go next?
I will.
Oh, thank you very much, Armani.
Things that make me angry are when my mom is yelling at me. I feel a sense of no love, hatred sometimes. And when people annoy me, it just bugs me so much.
Oh, Leon, can we keep our hands to ourselves? Because here's the thing, if we can't keep our hands to ourselves and we're going to keep disrupting the group, we're going to have to go back to your cell and you won't be able to do group.
He started.
Okay? So is that something that you two can agree on?
He started.
So, or we can
Fine.
move you guys.
Fine.
Okay, thank you. Sorry, Armani. Would you be willing to give us an example of maybe, I know you said when people annoy you, that makes you angry. Can you give us an example of something that's annoying?
when we're in class and everyone wants to be so funny, they make stupid noises.
So what do you do when they do that?
What I do when I'm angry are I lose it, I go crazy, and another thing I do is I throw things. Like I'll throw a pencil or an eraser at them.
So those are the things that get you in trouble when you make some poor choices?
Yeah.
Hopefully, by you guys coming to the group, you, Armani, and Leon, and a couple other you guys, hopefully we can teach you guys some skills so that you don't lose it so quick and be able to have some other alternatives. Okay?
Alright, thanks, Armani. Okay, who's next?
Nikhil's turn.
Are you ready to continue, Leon?
Yes.
Two things that make me angry is when people call me names. I hate it. Why can't they just call me my regular name? And another thing that makes me angry is when I get caught. Because one time I got caught and then I got in trouble by my mom. And I hate when I'm in trouble. Two things that I do when I'm angry is I hit people. I like punching people in the face. And I usually cuss. Like my mom, I cuss her out a lot.
Loser. Huh.
Armani, who's running around?
Sorry.
What makes me angry is when my parents don't ask for my input. And when people stare at me and call me a loser. And what I do when I'm angry is break things and scream and be rude to everyone.
Yeah, I guess I'll go next.
Thank you.
Loser's turn.
I feel like we might need to go over the respect rules again. You guys remember, can you remind me one of the rules about respect in group?
Not talking when it's other people's turn.
Ooh.
You have another one?
Treat others the way you want to be treated.
Right, and would you want to be treated like that when you were getting ready to speak? You speaking?
No.
Okay, so let's be mindful of that, okay? Because here's the thing, this group, you guys might lose your free time. Because right after group, you're supposed to have free time. But if we can't get through all this, then we won't be able to do free time. Right? So no basketball, because we're going to be in here until we finish. So, okay, so don't make your other peers lose out on their free time because you're trying to be funny. Okay, go ahead.
Okay. What makes me angry? It makes me angry when kids cheat at games because it's not fair. And it makes me angry when kids tease me. And things that I do when I'm angry. I like to hit people and I kick and scream.
Alright guys, I just wanted to have you guys look up here at the board. And we just got done talking about some triggers, right? Some external and internal triggers. Could somebody read the definition of external triggers for us, please? Armani?
External triggers are anything that make you angry.
Okay, so you guys listed two things that make you angry, right? And those were external triggers. Would you like to read the definition of internal triggers?
Internal triggers. Things that you say to yourself that make you more angry.
Right, and we didn't go over this too much. Can you give me an example of something that you say to yourself that might make you more angry?
Like, if somebody lies on me, I always like think in my head, I'm gonna beat this kid up after school.
Right. And does that make you more or less angry?
More.
More, right. So that's just one of the many examples of internal triggers.
Good job, guys. Good examples.
Good job.
So the next thing, go ahead and get out your hassle logs that we gave you guys. Make sure you have that in front of you, okay? So these are going to be pretty important every week, okay? Because we're going to have homework. And I know everyone's like, oh, homework. But it really, if you do it quick, it won't take any more than like 3 minutes, okay? And we're going to have rewards that you guys can earn if you bring back your hassle logs. If you don't bring it back, then we won't be getting a reward, okay? And we have some pretty good rewards, okay? So with the hassle log, we ready?
Yeah.
Okay. So the reason that we're going to be doing them is to make sure that you guys are actually learning the skills that we're teaching every week. Because every week we're going to be teaching a different skill. Okay? So we want you guys to fill this out. And so when you bring it back next week for group, you need to have the top part filled out, which is pretty self-explanatory. And then Leon, on the bottom, we're gonna have you fill out what your external trigger with that situation was and what your internal trigger was.
Alright.
Okay, does that make sense?
Yep.
So we're gonna be ending with a role play, and we'll end with a role play every week. So everybody will take a turn doing a role play. We're gonna be using your actual, we good? Remember, we're gonna lose free time. So you tell me when we're ready to continue.
Come on, guys.
Okay, alright. So every week, we're gonna be using one of your Hassalogs to do the role play, okay? But I think for today, we've already talked with Leon and who was the other
Me
person?
and the kill in the role play.
You guys were gonna do the role play. So
Yep.
what we need the rest of you guys to do is to watch their role play and figure out what the external triggers were and what the internal triggers were. Okay, can we do that? Okay, so we'll go ahead and get set up for that.
Shoot it,
Play
shoot
some
it,
ball,
shoot it.
man. Hey, man, push me. Elbow me, man.
Whoa, 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 whoa.
You elbow me for it.
I
Leon,
didn't help you on purpose.
God, I want to punch you in the face.
okay, we need to head back to our cell, okay?
Oh, man.
We
do
warned
this
you
all
about
the
putting your
time.
hands on people. Alright, good job, guys. Good acting. Why don't you guys go ahead and have... Okay, so these guys did a pretty good role play. Okay, can you guys see that happening here? Does those things happen here sometimes?
Yeah.
Yeah, right?
Yeah.
So who can kind of name someone's external trigger?
Ooh.
Here you go.
Well, when I saw them doing the roll, I saw the external trigger I saw was when Leon got elbowed. It seemed like it hurt him.
Okay, and so whose external trigger was that?
Yeah.
Leon's, yep. So when he gets hit, that was something that made him upset, right? So that's an external trigger. And that's something that might make him upset, but it might not have made you upset, let's say. Because everyone kind of has different triggers of things that make them mad. So something that's going to make Leon mad might not necessarily make you mad, okay? What about internal trigger? Did we see any internal triggers? Throw him the ball. Good catch.
When Leon said that he wanted to punch Nikhil in the face, that was an internal trigger.
Because it made him more angry or less angry?
More angry.
More angry. Okay, and as we continue to go through the sessions, we'll teach you guys of things you can do and say to yourself that actually make you less angry, okay? Good job today. Don't forget to bring back your Hassalogs next week.
All right, see you guys next week.